Courtney. Good morning, Courtney.
Good morning, Lindsay. All over the news lately has been talk about SARS, or Severe Acute Respiratory Syndrome. Today we will spend our time informing our viewers with just what exactly is going on. SARS started in Hong Kong and has moved to 37 other countries and is responsible for nearly 700 deaths and over 8,000 cases.
There are still many unknowns about SARS, but what we do know is that the microbe responsible for causing SARS is the coronavirus, the same virus that causes our common colds and upper respiratory illnesses. It is believed that the coronavirus spread to small mammals in China, such as the palm civet and bats. The virus mutated or changed to something the world did not recognize and reinfected humans with the new unknown virus.
The main way of spreading SARS is person-to-person contact. It's transmitted mostly through respiratory droplets, which is when a person sneezes or coughs, and then those particles enter through the eyes, nose, and mouth of an uninfected person. A person can also get SARS through touching contaminated objects or surfaces and proceeding to touch those same areas. At this time, it is unsure if SARS can be spread through the air.
At this time, we need to take a commercial break, but when we come back, we will have more on SARS and what you need to look out for and what exactly happens if a person does get sick.
When it comes to being better, what's better? Being better or worse?
Better!
Okay, and what are you better at?
I'm better at telling jokes.
Okay, let's see what you got.
Knock knock.
Who's there?
Queen.
Queen who?
Queen, my dishes, please.
Clean.
It's Queen to make it funny.
He doesn't get it.
It's not complicated. Better is better. And AT&T is the nation's fastest and now most reliable 4G LTE network.
Welcome back. We are talking about SARS on this special news today. We are going to go right into the symptoms and signs of SARS.
Within 2 to 3 days of being infected by another person, you may have symptoms starting. They can include fever of 100.4 or higher, chills, headache, and body aches. You may start having chest pains and problems, and within the next couple of days. Usually this is when you start to feel worse and seek medical attention. These chest pains usually present within 2 to 7 days of the first exposure and present to the doctor as pneumonia.
The chest pains are likely to include shortness of breath, difficulty breathing, which also leads to low oxygen levels. Along with these symptoms, you will most likely have an abnormal chest x-ray. Some patients with SARS experience severe diarrhea and vomiting. If you do not seek medical attention with symptoms like that, you could die.
With symptoms like that, it can affect many areas of your body. The lower respiratory tract or lungs are severely impaired, which cause lack of oxygen, which also affects the entire body organs, including the brain. This can cause seizure activity and organ failure. In 10 to 20% of the cases, the gastrointestinal tract may be affected, causing severe diarrhea and vomiting.
This does not sound very pleasant, Lindsay.
Not pleasant at all, Courtney.
With SARS, your doctor may diagnose tests. These include arterial blood tests, blood clotting tests, blood chemistry tests, chest x-rays, or a chest CT scan, or a blood cell count can be completed. Other tests to be more rapidly identified would be to isolate the virus in a laboratory setting.
Treatments available are not favorable. They include the use of supplemental oxygen and mechanical ventilators for breathing support, high doses of steroids to help reduce swelling in the lungs, antibiotics used to treat pneumonia, and some antiviral medications, though it is not known how well they work against SARS.
This time we're going to take a quick commercial break and then we'll be right back.
Ship my pants? Right here? Ship my pants, you're kidding.
You can ship your pants right here.
You hear that? I can ship my pants for free.
Wow, I just may ship my pants.
Yeah, ship your pants. Billy, you can ship your pants too.
I can't wait to ship my pants, Dad.
I just shipped my pants, and it's very convenient.
Very convenient.
I just shipped my drawers.
I just shipped my nightie.
I just shipped my bed. If you can't find what you're looking for in store, we'll find it at Kmart.com right now and ship it to you for free.
If you get SARS, your chance of recovery is about 88% if you are a young, healthy individual. If you are older, above 65, the chance of survival is about 50%.
Courtney will help demonstrate what you can do to protect yourself so you don't get SARS. Wearing protective wear such as clothing, protective gowns, masks, Protective eyewear will help lower the possibility of SARS getting into your system. Good hand hygiene, washing your hands with soap and water, lots of friction and getting underneath fingernails. Staying away from those infected and keep them isolated will help you to not get sick.
We hope now, with a better understanding of SARS, you and the public will seek rapid medical treatment if you think you are infected or do not feel well. We hope you will be safe and know how to protect yourself and your body from SARS.
Now let's hear from the rapping weatherman. Have a good day, microbiology.
All right, folks, 8:34, and once again, it's time to bust out the old sunglasses. It is time to rhyme. Microphone. Thanks, man. Appreciate that. All right, really cool. Hey, let me get a beat real quick here. You ready? Can I get that beat? Somewhat, anyway. All right, here we go. Let me clear the throat. See, it's been a little while, but guess who's back? The rapping weatherman with a new rap. What's today's forecast? Well, let's check. Yeah, it'll be nice as heck. Highs in the 60s, mostly sunny. The perfect weather if you want to wear a snuggie. Tonight'll be cold, so when you're in bed laying, you better get close to someone. Know what I'm saying? And for tomorrow, expect the same weather because of one letter. Thanks, high pressure. When you see our show, DVR it. Good Day is running this market. Mike's the best anchor on your TV. The man is a modern-day Ron Burgundy. And Diane Dean, she's new to the show. She's already better than her two co-hosts. And if you need a forecast, come to me, yo. I predict so well, they call me Mr. Cleo. So watch Fox from 6 to 9 o'clock, because the show rocks and the news and weather never stops. We are hot shots. We are on the scene before the cops. We outcover other stations because we're juggernauts. And in the spring and summer, when you're wondering, I wonder if the rain and thunder's coming or not. Well, guess what? Yup, we've got the tightened up so we know where and when and why the rain is gonna drop. Okay, I'm gonna stop, not because I'm out of rhymes. Frankly, I'm just tired of blowing minds. Until the next time, search me when you can. I am the rapping weatherman.
Audio Jungle.
Good day, microbiology. 10 years ago, we told you about SARS, and to this day, we have not heard much more about it until now.
That's exactly right, Courtney. Coming from the Middle East is a new SARS-like virus. From our friends at CNN, here is Atika Schubert.
Hussein al-Sheikh says his father died after a chest infection that quickly worsened into kidney failure. Soon after, other family members fell ill too. Doctors now believe it was the new deadly coronavirus.
Well, the first time they told me I have corona, the first things I thought about is I'm gonna die. Because I thought about my dad and I said it's going to be the same case and I'm gonna lose my life.
This is NCOV, and the World Health Organization is monitoring it closely, especially now that human-to-human transmission has been verified between patients and from a patient to healthcare workers. Doctors from the WHO are in Saudi Arabia to monitor the spread of the virus.
Of most concern, however, is the fact that the different clusters seen in multiple countries increasingly support the hypothesis that when there is close contact, this novel coronavirus can transmit from person to person.
Now, according to the Centers for Disease Control, this is where the virus was first detected in April 2012, Saudi Arabia. Then it spread to other countries in the Middle East, including Qatar and Jordan. Now, by February of this year, travelers to the Middle East had brought the virus to Europe. France, Germany, and the UK all reported mostly isolated cases. Now, there have been at least 40 confirmed cases, and 20 of those patients have died. The largest cluster is in Saudi Arabia. Doctors say anyone with sustained daily close contact with an infected person is at risk of contracting the virus. There is no evidence yet that it can be passed on through casual contact, but health authorities are keeping a close watch for any indication that it could spread more quickly. Atika Schubert, CNN, London.
Thank you for watching the special news bulletin. Have a good night, Lindsay.
You too, Courtney, and you all make sure to wash your hands.